instinct takes over.
Oh, just a second.
It's over.
A lot of times I'm on the field and
Paul Coleman here, Coleman Center for Cosmetic Dentistry. Just getting psyched up to watch a little football. If you're a football fan this year, you're going to know that there's been some huge controversies in the sport. They're actually changing the game right in the middle of the season. Why? Because of brain injuries. They're concerned about concussions. As these guys are getting bigger and stronger and faster, frankly, they're about killing each other out there. Now, I'm not really big about legislating violence out of a game that's designed for violence. Played a few football games myself and had a few concussions myself. What is a concussion? Well, basically, your brain gets rattled around in your head. The skull's kind of hard, the brain's kind of soft. When you get hit, it smashes the back of the brain. Not so good. And when you have the repeated concussions, it has some long-term health effects, which are becoming more and more obvious and more serious. So, how do you prevent concussions? Well, certainly you can change the rules of the game, which probably isn't going to happen to any great degree. The other thing we've been doing for years is a mouthpiece. A mouth guard goes into your mouth, and it's like a shock absorber. It keeps your teeth from slamming together and kind of cuts down on the vibration that your skull has to put up with. Now, the most popular ones are the cheapy ones you can buy down at any sports authority for 12 bucks. They're called boil and sucks. You take something, you put it in boiling water, put it in your mouth, cinch it up, and it kind of stays in place. These do the trick. They do help, and I was wearing them 45 years ago. And they haven't got much better since. But there is an improvement that is unbelievable. A friend of mine came up with a process called Pure Power Mouthguard, and using the principles of neuromuscular dentistry, we can position the jaw in an absolutely perfect location so the whole upper body fits better together. If you think about the best athletes we've ever seen, Michael Jordan or Kobe Bryant, or even Tiger Woods, when they're really concentrating on an athletic endeavor, they put their tongue in a certain position. They instinctively have realized that if their jaws are in a certain place, the muscles in their neck are in a perfect alignment. Well, through the science of neuromuscular dentistry, we can actually attain those same effects in the mouthpiece itself. So we have a performance-enhancing mouthguard. All the New Orleans Saints, the Seattle Seahawks, Shaquille O'Neal, Terrell Owens, a ton of mixed martial arts boxers, professional athletes of all type, Elkington and McCarron on the professional golf tour, know that if they put their jaw in a better position, their body functions better and their athletic endeavor is enhanced. So if this sounds like something that you'd like to get involved with, even if you just want to shave a couple of strokes off your game and maybe finally beat your wife playing golf, maybe you want to give me a call. Paul Coleman, Coleman Center for Cosmetic Dentistry, or visit us on our website at www.drpaulcoleman.com. That's it for this week's segment of Dental Health with Dr. C. See you next week.